Welcome back to the channel that's cutting edge pain relief, talking about how you can be able to help punch your pain in the face and get back to leading the life that you deserve. I'm Dr. Orlando Landrum. Thank you for joining. And today we're talking about TMS and how it can help for both depression as well as pain. So, what is TMS? TMS stands for Transcranial Magnetic Stim. It's a type of treatment that we're going to talk a little bit more in depth and detail about that's non-invasive, that's not based off of medication, it's not opioid, it's not injections, it's not surgery, but it's a way to be able to treat both depression and potentially also pain as well. So let's get into a little bit of discussion about this. Um, so when we talk about transcranial magnetic stem, there are a number of different companies that are out there that actually provide a potential option. The company that we've chosen to ally with is a company that's called Neurostar. And they've treated a number of patients successfully. They have the most prominent amount of literature that's present in the research studies. And they actually have a number of different reasons for why they provide benefit. Foremost among them being that they have something that's called a registry that allows for you to be able to track historically how well patients have done. But sometimes that doesn't always mean that much. What really means a lot for many people is to hear how other people have done with the treatment. And so in this context, we're talking about patients predominantly that have been treated for depression. And some of their various different quotations are the following. Miraculous that the Neurostar TMS treated is right exactly at the source, which is my brain. When you're depressed, you're always fighting to live, to survive the next day. Neurostar made such a difference. All of a sudden, I felt empowered. I felt strong. I felt like I wasn't a victim anymore. Neurostar treatment has changed my life. It's given me life. It's given me joy. It's given me opportunity. I live with depression. I will always live with depression, but it doesn't have to win. I can fight the battle. Neurostar can give me another way to fight depression. So when we talk about Neurostar and we talk about TMS specifically, it's really a treatment that is a non-invasive treatment that is targeted towards a certain portion of the brain that can help for depression and a number of different symptoms. What many people will ask is, so how does it work? And so there's a number of different research papers that have been out there, but let me take a step back for a second. So for myself, I came across TMS, transcranial magnetic stem, about maybe 8 years or so ago. And how I came across it is actually I went back to Boston to go do some training. And at one of the hospitals there, Beth Israel, they were having a conference that looked at TDCS and TMS. And what we were really interested in was how can you be able to use non-invasive neuromodulation of the brain to be able to help people. So I know that was fancy language. What I mean, and kind of like breaking it down, is that how can you use the brain to really be able to help pain, right? And instead of doing invasive type of treatment options like you would do like a deep brain stimulator or even a spinal cord stimulator, there have been theorems out there that you can use how the brain modulates your body, your mood, to be able to give a response by influencing it through different dynamics. I went to this course. I thought it was going to be a small course that would be local to New Englanders. So you'd have people from Massachusetts, Connecticut, Rhode Island, that and such. But it wasn't. It was attended by an international group of physicians and researchers from people from Australia, New Zealand, from Asia, from Europe, a whole host of different places that were already in the know. And I just happened to catch it, and that's just by happenstance, where you start looking at how TMS can be able to do a number of different treatment options. So transcranial magnetic stem is like a tapping. And depending on where you place it, that's what the patient perceives. They perceive like a tapping to the outside of their skull. And making a divergence for a second, I've had a number of people that I've talked to that have said, well, I mean, is this going to change my mood or my thoughts or anything like that? and not even close. The best way to kind of characterize it is the same as if you had an MRI, right? Tons of people have had MRIs that show the images of different parts of the body. And instead of you thinking about a full body MRI, you have a magnetic sensation like an MRI that's targeted in order to get an achieved result, right? And for those people who haven't had depression, um, first, you're lucky. Second, it can influence all of your life. It can make normal activities very difficult to be able to deal with. And what frequently isn't spoken about, and we've had a couple of videos talk about this, is how when you're in pain and you're not able to do what you normally would be able to do, how really common depression actually is. Because who you are is still the same, but what you can do and why you really want to be able to do it sometimes changes. And no one really wants that, right? So addressing that portion of the person is huge. And knowing and experiencing depression where you feel like your day is just a trial to be able to get through is nothing that anybody would want to wish on probably their worst enemy. So finding a way to be able to deal with that and not have the side effects of medications and not have the onerous drudgery of having to take a medication every day that may work, may not, may have side effects that are associated with it, and just not that great of efficacy, just that alone is one of the things that's hugely valuable. For our patients that are watching locally within our area, it is a therapy that we'll be able to deliver to patients and or probably as soon as actually this month. So for those of you who are interested, please let us know in the comments. But for those patients who say, you know what, depression is not my major thing, anxiety I have a little bit of, some OCD I might have some changes with, some of those type of things, it has treatment functionality for it, but for depression, it actually has insurance coverage. When we look at some of those individuals who came from other countries, they're using it for a whole host of treatment options because their countries actually have either coverage or people are willing to pay out of pocket, from everything from being able to decrease cognitive decline and dysfunction so that as you age, you don't lose your degree of sharpness, to being able to deal with post-stroke pain, which is really personable for me because of the things that my dad had after having a stroke and having pain accordingly, and is a very difficult um, problem to really be able to treat. And when we look at pain as a whole, TMS has really found usefulness for some of the most challenging, for some of the most challenging types of pain that's out there. So specifically neuropathic pain that can be of a different course, right? So neuropathic pain is nerve pain. It can help for fibromyalgia. It can help for myofascial components, and they've seen it. This is not just something that's like, okay, well, we've gotten a couple studies. The studies have been out there for greater than 10 to 15 plus years and really been able to kind of lean into it. And so being a cutting edge practice, one of the things that we really wanted to do was to figure out how can we be less invasive with a better result. And it's one of the things that we've really leaned into to not only can we help people be able to take their life back and really be able to lead a full life by helping them with their depression, but also being able to look at are there ways for us to be able to address pain that's difficult without us having to be reliant on a pill, being reliant on an injection, or being reliant on surgery. So that's what we're going to talk about. So when we get into the context of looking at the how, there's a number of papers that are out there that are really kind of sort of honed in on that. So one such paper is a fancy title that basically says the elevated prefrontal cortex GABA in patients with major depressive disorder after TMS treatment measured with proton magnetic resonance spectroscopy. Okay. So for those of you who are fancy and understand medical lingo, I'm sure you were able to get that. For some of you who are not so medically inclined, we're going to explain to you what exactly that means. So what it's saying is those people who have depression, that they have seen that there are changes in a transmitter that's called GABA, which we'll explain in just a little bit. And they've been able to measure that change and how TMS is able to cause that to be present or not. right? So the explanation is the following. And I'll read a little bit of this, but bear with me as I kind of go through some terms here. The major inhibitory neurotransmitter system represented by GABA is at the intersection of the pathophysiology of depression as well as mechanisms of its treatment. So basically, they think that this neurotransmitter named GABA is possibly one of the major issues or major causations, I guess, of depression. And so then, if you use transcranial magnetic stimulation or over the left dorsal left prefrontal cortex, is what that DLPFC is. It's the area of the brain where you place the instrumentation at. It improves depressive symptoms, and this is correlated with selective elevations of GABA in different parts of the brain. So, in essence, what this is able to do is to be able to change a neurotransmitter that we naturally have, not add anything to it, right? But really increase what's normally within our body in order to be able to improve our mood. And it's in similar ways that it's actually able to address some things from a pain standpoint. So there's other studies that looked at transcranial magnetic stimulation in the treatment of major depressive disorder, a comprehensive summary of the safety experience from acute exposure, extended exposure, and during reintroduction treatment. So what these studies looked at were kind of the following. So the first little selection of this paper, you may not be able to see because it's very small print. However, when we kind of get into one of the other areas, basically the results were the following, is that there were 10,000 treatment sessions that were done in this particular study. And most were only that you had possibly a headache or some scalp discomfort as the adverse events. And the discontinuation, meaning that people stopped using transcranial magnetic stim, only occurred in about 5% of patients. So you have the benefit of being able to improve a number of different things, but specifically depression in particular. And the number of people who completed the therapy and treatment was approximately 95%. So almost every patient that had it said, you know what, this is of value to me. And I really feel like I can be able to complete this therapeutic option in order for me to get benefit. So for those of you who are joining us live and joined just now, what we're talking about is TMS, Transcranial Magnetic Stimulation, which is a type of non-invasive stimulation that's used for a whole host of different treatment options. Here in the States, it's indicated, FDA indicated, and covered by insurance for patients that have major depression and have traditionally failed two type of antidepressants, right, where it just really hasn't worked. Outside of the States, it's actually used for other things besides just depression alone. And so it's been used for neuropathic pain, fibromyalgia. It's been helpful for anxiety, OCD. And so one of the things that's really useful from a standpoint of our patients who are local, it's a therapy that we're offering. And we want patients to know about and really avail themselves of so they can be able to get the best benefit. So from that company, we have a number of other different quotes that were in place too, where they'd taken 11 different medications for depression. You hadn't gotten any relief. And NeuroStar treatment has been able to help this person get their life back with a happiness like they've never had before, right? So let's talk a little bit about what are some of the simple things to kind of understand about what TMS is. Simple things are things like this. So it's been FDA cleared since 2008. It's a non-drug, it's non-invasive, there's no side effects, it's not ECT. So for those of you who don't know what ECT is, being an anesthesiologist, I've done anesthesia for ECT, where you give someone and you make them off to sleep a little bit. ECT is where you have this electrical shock that causes this change across the brain that is meant to be able to improve pain. That's not what this is. This is like a light tapping, almost like if you had a kid that came by and kind of tapped you on the forehead repetitively. This is what this type of treatment is. So it's not something that's a painful stimuli. It can provide long-lasting symptom relief. It's been quoted in some papers that about 2/3 of patients that get treated have sustained relief and don't need to have boosters to be able to come back. but a booster, relatively speaking, is nowhere near as long as what you'd have for the traditional therapy, and really for many people is worthwhile and useful. It's covered by most insurances, and currently to date, over 3.5 million treatments have actually been delivered. So when we look at transcranial magnetic stem, one of the things that actually one of our comments is it annoying? Well, truth be told, it's probably not that annoying, to tell you the truth, if it's getting you the benefit that you want. Normally the session is going to range anywhere from 20 to 30 minutes of having that tapping. The difference is that it's going to be a session that you have to commit to having it done on a daily basis for, give or take, about 3 to 4 weeks. Okay, maybe a little bit longer, depending on your condition. But be that as it may, what I would say to you is the following. As a therapy, I think we're only just starting to see its benefit. And as insurers start to see how it can be able to not only help for depression, but how it can help for other treatment options that are out there, it really is a treatment that can provide a heck of a whole lot of relief. By the way, for those of you who are live, please ask questions. I definitely want to be able to kind of make sure we're feeling this. So the question is, if you can't read that, is it done by an MD? So the initial portion is a mapping that kind of detects where your motor cortex is, and then we relate the area that needs to be treated in relationship to that. So normally that's done by an MD. It doesn't necessarily have to be done by an MD in all states. And then after that is actually the treatment sessions. And normally that's not per se done by an MD. It's traditionally done by a transcranial magnetic stimulation sort of therapist or specialist, if you would. But once you have your plan, you can be able to implement that. And after a period of time, you'll have a response that will be able to let you know, yeah, we've gotten some degree of benefit. Other questions that you guys might have, please shoot them. Let me know. So Neurostar, again, is the company that we picked. And with over 3.5 million treatments delivered, Neurostar is treating depression at its source, one magnetic pulse at a time. And it really has been able to impact a number of different people and make their lives better. And I guess one of the things that I've had people ask is, so how prevalent is depression among pain patients? And I think if someone's asking that question, then they probably never been a pain patient, or they probably never worked with pain patients before, because it's really common, really common. And for our patients, that we treat, it's one of the reasons why we use an app that's called NeuroFlow that lets us be able to track what your depression is like and how it correlates with pain, because we care and we want to figure out how can we be able to not only make your pain better, but make your mood better. And quiet as is kept, one of the things that we're really trying to make sure is that patients don't have that suicidal ideation, that we can find a way to be able to be aware of issues and potential harm that you may have, and how can we be able to alleviate that and give you a better quality of life while we're treating your pain and your function, by also taking a look at how your mood is and how can we be able to improve it if possible. Any other questions about transcranial magnetic stem? Today is kind of that overview. We're going to circle back around and talk about the individual pain syndromes that it has an impact on. We're going to talk a little bit more about depression and how it improves overall treatments, and how you might be able to stop your utilization of medications if you have those on board. We're going to kind of get to that. Okay. I think one of the questions is it usually used along with medications or in place of? Yeah, right. It was right on time. So it kind of depends, but normally what most people will do is we traditionally won't stop your medicines right off the bat. We'll use a TMS, see how its improvement happens to be, and then after that, we'll have to be able to, rather not have to, but we desire to be able to decrease your medication. For most people, can they be able to get a medication decrease or cessation? I think that that's the case. And I think that there's a lot of value to that, because as we know, polypharmacy can cause a whole host of different issues, from, if we're being fancy, morbidity and mortality, or if we're not being fancy today, what we're talking about is for people not to have the same degree of potential sickness and possible death, right, by us decreasing medications and the potential risks that are involved. Okay, so the question is, because it is somewhat new, will the appointments be flexible around work schedules? You can see there's someone who's being self-serving. So no, um, it probably won't be that flexible. And the reason why I say that is because, without sounding cocky, for our own personal patients that are local to us, as opposed to that are spread throughout, who are viewers of this, this is one of the cutting edge treatments truly out there, that has been around since 2008. It has tons of literature that is able to be able to support it, but there aren't that many physician practitioners actually utilizing it, because they just, without um, sounding cocky, they haven't necessarily really delved into it, and they haven't done their due diligence to figure out how they can be able to help patients. So for us, we already have a list of patients, and it's starting to grow pretty rapidly, of who are wanting to be treated. And so they're starting to become a fixed number. So we might have to have some patients who are interested really be moved off to a time frame a few months down, where we can be able to help. Okay. Next question is, does it help with pain by decreasing depression, or might it help pain? Okay, so yeah, Elaine, that's on me for not explaining this correctly. It doesn't just help pain by improving depression. It can help pain. And the issue, and the reason why I'm not mentioning that as our primary piece, is FDA hasn't indicated it as such just yet. But we anticipate that that might change in the future. Um, so it can be able to treat, like I said before, incredibly difficult to treat pain options. And what we really have to look at is, how do we make that feasible outside of the insurance scope at the moment, when we're treating just directly pain. Right now, for many and most people, insurance is cover depression treatments. And so those are kind of the distinguishments of how the two are being separated right now when we talk to patients. Is it covered by insurance, or is it not? We have a number of patients that we treat for regenerative medicine therapies that are not covered by insurance, and they pay straight out of pocket in order to be able to get it there, because they know there's value and there's science behind it. Same type of token for this type of treatment option. We know that there's science behind it, and there will be some patients that will say, you know what, if you can show me the literature and you show me the registry of how this has helped people, that will be willing to kind of go outside insurance means in order to be able to make this work. So it's not just depression improvement, though I do think that if you can improve depression, many times you can be able to improve pain. So those two are kind of tied together. But in terms of how the actual machinery works, it's not just a depression fixer. It does a lot more than that, in terms of being able to improve multiple different types of problems. Okay, so we just wanted to make sure that our personal patients and followers knew about transcranial magnetic stem. If you're not local to us, I would definitely encourage you to look at neurostar.com, and be able to see, is there a provider that's close to you that can deliver you care, that can provide you relief. If you are close to us, please leave us something either in comments, or send us something via chatbot or website, to let us know that you're interested and you want to be on the list. And hopefully, this has been something that can be able to help someone not only be able to improve their quality of life, but prevent them from taking dire measures that doesn't that really may not need to be taken, and how we can be able to help you make sure that you can be treated, that you can feel valued, and that you feel that we can get you back to leading the life that you deserve. Thank you so much for joining us today. Have a great day. We look forward to talking to you again in the future.